Hey guys, welcome to this series on rhinoplasty. Hi, I'm Dr. Saumil Shah. I'm a board certified plastic surgeon and director of plastic surgery at Skinzone Aesthetics, Mumbai. Today we'll be speaking on what are the kind of patients who usually get rhinoplasty or nose jobs done, on what are the different kinds of nose jobs, when it's done for functional reasons, when it's done for aesthetic reasons, and if at all your nose job can be covered under insurance. A good nose, for example, should be harmonious with your face and should not stand out, and that is actually the goal of rhinoplasty. Now, the common patients who come to us for rhinoplasty are usually of two kinds. One are for functional reasons, who have problems with their breathing. These can be because of a deviated nose, a deviated septum, because of something called a septal spur where a bony outgrowth is there, or there's some soft tissue outgrowth. Okay, these are abnormalities, and these are surgeries that are done for functional reasons. They usually include surgeries of what is called as the septum. We'll talk more about this, and along with that, if they want, we can also do an aesthetic reconstruction of the nose, but that is again a different topic. There's a second class of patients who come to us only for aesthetic results. Now, these are patients who want very specific things changed in their nose. Things such as where they want the nose bridge to be changed. It can be very low or it can be too high. They can have what is called as a hump on the side of the nose. These can be changed. Some people have a broad tip, some people have a round tip, some people have a flat tip. So we can do a septoplasty or a septorhinoplasty depending on your needs. Coming to what is an ideal nose. There's nothing defined as such as to what is an ideal nose. An ideal nose for someone may not be quite the right nose for someone else. A nose defines ethnic characteristics which in my opinion should not be changed. We are basically giving you your own nose but just refining it a little bit, and that is what rhinoplasty is about. Now, if you as a patient are concerned about something specific in your nose or you have problems breathing, you need to first come in for a consultation. Rhinoplasty, unlike any other thing in cosmetic surgery we do, is very, very customized. We can change one particular thing and avoid changing another thing, or we can change your whole nose as in toto. There are different techniques that are used in rhinoplasty, and all of this can only be assessed once you come in for a consultation, or we need to have an online consultation. The most important thing in these consultations is going to be photographs. So basically the photographs are going to be in different views. The needed views are as follows: the front view, the profile views, the 3/4 views, the view from the bottom, and the view like you're reading a textbook called the textbook view. You need to take it from the back camera because the front camera has what is called as a fisheye effect, where the nose is distorted and it looks different from what it actually is. And this is very important. Again, you need to be 2 feet apart because when you're closer, there's again this fisheye effect which gives the nose a distorted appearance. The pictures need to be sent in good definition. So if you're sending it to us on WhatsApp, it's important that you send it as a document file. Or you can email it to us, and that is the best thing. Now, coming to an online or an in-person consultation, you will need to have some idea about what you want changed in your nose or what problems you want to be corrected in your nose, because that helps me make decisions better rather than just saying that you want something changed. Of course, we can help you out with the thought process as to what needs to be changed, but it is always better if it comes from you and it is thought out a bit, because then you will also know as to what you would like your nose to look like. Another thing, if you have particular photographs of what kind of noses you like, that is also quite helpful. We will not give you that particular kind of nose, but then we actually know, and it's a better way to just communicate as to what is in your mind. A third thing is that many a times with rhinoplasty patients, we like to have more than one consultations, where in the first consultation we tell them that this is what we are thinking about. And in the second consultation, they make up their mind after a few days, come to us, and they express their opinions whether this is actually what they wanted or whether it is something different, and we can actually do this as many times as possible. Now coming to what can be covered under insurance and what is not, it's very simple. If we are doing a surgery for functional reasons, where your nose is blocked and you have problems with breathing, it is covered under insurance or Mediclaim. If it is just for cosmetic reasons, it is not. If we are doing a part of the surgery for improving your breathing, then that is covered under insurance, and whatever is cosmetic is not. So say if you have something like a very strongly deviated nasal septum. So septum is the central part of your nose that divides the nose into right and left. If that part of the nose is strongly deviated and it's closing one part of the nares from where you breathe, this does come under insurance. If you have something called as a bony growth called a spur, it does come under insurance. So we'll need to first investigate. If you have some problems with breathing, we may ask you to get a CT scan done if you have had previous trauma and now you have a very badly structured nose. If any of this is present, this can be covered under insurance, but if it is cosmetic, again, it won't be. These are the most basic things that you need to know about a rhinoplasty or a nose job consultation. If you need to know more about any of the surgical things that we do during a rhinoplasty, the pre-operative and post-operative care that you need to do, or even if you need to know something about non-surgical rhinoplasty, do check out the videos in our link and in this series ahead. Do not forget to subscribe and like these videos, and do let us know if you have any other queries regarding rhinoplasty.